Okay, hi everybody. I'd like to welcome you to this other special webinar from the International Academy for Clinical Hematology. As you may have noticed, we have been organizing weekly webinars dealing with different topics and different aspects related to the COVID-19 pandemic emergency and the impact or consequences on hematology. Of course, everybody's familiar and everybody noticed that healthcare professionals are being considered as heroes everywhere. And the general public is extremely grateful, and we've seen lots of signs of solidarity and support to the healthcare professionals. During this webinar, we thought with the organizing committee of these webinars that we would like maybe to address and have listened to the point of view of a nurse. Because nurses particularly have been on the forefront of this fight, and we have to really be grateful to their involvement, to their dedication in this crisis. Of course, we have also a special thought to all the healthcare professionals who lost their lives during this pandemic. The fight will continue, and hopefully we'll be able to get rid of this nasty COVID-19. So to discuss the nursing perspective, it's my great pleasure to welcome today Michelle Kenyon. She is a nurse consultant at King's College in London. She's also the president-elect of the nursing group of the EBMT, and most importantly, she has also volunteered during the crisis to be in an ICU unit dealing with COVID-19 patients. So, Michelle, thank you for joining us, and I would be more than happy to listen to your thoughts and how did you live these different challenges that we have been facing. And my first question to you is about the impact, the direct impact of this pandemic on the nursing workforce in terms of mobilization, introducing new practice. How did you prepare? How did you organize the whole stuff?
I mean, I can really only speak mostly from my own experience, which I would have to say has been extremely positive. There has been a big move to enable nurses to be able to contribute to the workforce in a very meaningful and positive way, and a lot of support has been available largely in order to be able to enable that to happen. So in terms of training courses and clinical skills refreshers, so that nurses have been equipped with the skills and the tools to be able to work more flexibly and to be able to adapt to different ways of working from their normal everyday practices. I think one of the most important aspects of that training and education has been training and consistent messaging around the use of PPE and the practices surrounding that, so that the workforce feels, first and foremost, feels safe but also that the PPE that we have got is being used correctly and appropriately in the right areas and the right environments to protect not only us as the workforce, but also to protect the patients that we're looking after.
Yeah, so you're raising absolutely an important issue that we have been highlighting several times during these webinars, is about not only protecting the patients, obviously, because in hematology we're dealing with highly immunosuppressed and vulnerable patient. And I think I read that in the UK, actually, the government has clearly written on the recommendation that a bone marrow transplant patient or a patient treated for leukemia or myeloma is considered as a vulnerable patient. But besides this, I think protection of the healthcare professional has been really an important matter of concern.
Yeah, I mean, a lot of our patients have been written to by the government, so a central initiative around shielding practices. I'm not sure how that's been managed outside of the UK, and some good guidance around how that shielding is to be implemented, and the differences between shielding, which is the sort of most high-end method of sort of isolating people from other members of their family, even, and other members of their household, to identify the differences between that and social isolation, and then the distancing measures that we're all practicing when we're out and about.
So here it makes me think about our hematology patient, and I wonder what kind of feedback did you have when it comes to these shielding, confinement, protection measures? Because actually many of our patients are routinely, I would say, applying these rules.
Yeah.
So what was the reaction?
Yeah, so we had lots of contact and still have lots of contact from patients as they themselves process new information that might be arising through the media, and try to make sense of how that applies to their own individual situations and cases. We have, in my organisation, have produced some patient information literature that accompanies and supports the information that's been distributed through the Department of Health, to enable our patients to kind of understand how the information applies to them, but also to help them to make decisions around where they need to be concerned around developing symptoms or being in contact with others who might have developed symptoms of COVID. So that has been well received by patients. We've had some really good feedback around that and the helpfulness of that information for them. I think it's important that that messaging, as the story has changed and the information around that has changed, we've also adapted and amended the information that we've given to the patients that accompanies the centrally available information. And again, that's been helpful. So sort of maintaining a response that is appropriate for the time that we're in, as this has been very much an evolving and changing situation.
Okay, so that was the hematology side, but then you decided to volunteer to go and help in an ICU unit. Why did you take this decision? Was it because you felt, I mean, there was a need in the hospital, or was it because you felt that you have some important expertise that could be useful during this crisis?
No, I mean, I like many of my colleagues. I'm not unique in having volunteered to support other clinical areas. I happen to be supporting staff who are working in ICU, but many of my colleagues are supporting staff working in other areas of the hospital. I'm a trained nurse, first and foremost, and so I have skills to offer in that respect. I'm not an ICU trained nurse, so I offer my skills in a supportive role.
Well, this is fantastic because it proves clearly that when it's needed, we all can be very useful, and there are no borders, you know, although we live in different departments in the hospital, but when it's needed, actually these borders disappear. Fantastic. So let me move to the second question of our discussion, which is about the psychological impact that you went through on a personal level, if you allow me, on a family level, with your patient. I mean, as a physician, I can tell you, I've been going to the hospital every day, and I could see the huge psychological impact of this pandemic on everybody around us. And I must confess that we heard a lot of healthcare professionals, for instance, being afraid when coming back in the evening, coming back home, you know, taking the risk of contaminating their families and their neighbors or whoever. So how did you go through all this?
Yeah, so I'm married to a doctor, and both of us work in the hospital setting. And you know, when we come home from work in the evening, we shower, and all our clothes go straight in the washing machine, and that's how we so far have kept our family protected. I have two children, one of whom who was due to sit GCSEs this year. Those have been cancelled. He's not been too troubled by that, and they have been really adaptable. They have online schooling now that the Easter holidays are over. They have a routine. We're all getting exercise, which I think is really important. And I think for myself and my husband, you know, we still go out every day and go to work. So in many respects, although our jobs feel different at the moment, we still have the essence of a routine, and we're not at home all the time. So I think we've been quite fortunate in many respects. We keep in touch with our other family members very regularly, more regularly now than we did before, via sort of video calling and regular telephone calls. The kids are writing weekly letters to members of the family, and that also has been a really nice thing for them to do. Neither of which of the boys were letter writers previously, so it's been, yeah, you know, there have been some nice things at home that have changed.
So it's definitely in line with what you mentioned in your introduction, that you're viewing it more positively than negatively. And well, I fully agree with you that the adolescent, and I've been talking to my son, exactly the same feeling, because when I asked him how, you know, are you living this confinement and so on, he said, oh, that's not bad, you know, schooling, you know, by internet is very good, I like it, and we have more freedom, and we are more relaxed. So indeed, I think the reaction of the adolescent is slightly different from the adults. But I also agree with you that for us healthcare professionals, we are quite fortunate and privileged because we still have this freedom of circulation. Just by going to the hospital and coming back, it gives you already, which may not be the case of everybody.
Yeah.
So, what did you hear from your patients in terms of psychological impact, or from the caregivers?
Yeah, so I think from our patients, you know, there are consistent themes with their concerns, their concerns for themselves, their concerns for their families, concerns for their jobs, concerns about how and when things might resume some sense of normality, and trying to get some sense from us as healthcare professionals as to when that might happen. And of course we don't have that information. We don't hold those crystal balls. One of the most important thing has been around helping them make sense of the information and keeping them safe at home, whether that be shielding or whether that be self-isolation, enabling them to get the right support, checking in with them that they have people around them who are able to provide shopping and jobs outside of the house if they're not able to do those for themselves. So I think for patients, I think that's been one of the biggest concerns around what level of intervention they need to be able to stay safe. You know, does it have to be as extreme as shielding, or, you know, is self-isolation, social distancing, are those measures okay? I think in terms of their anxiety, I think I haven't come across a lot of anxiety right now. The main sources of anxiety are around when will things get back to normal, and what will that look like, and how will that impact on them and their daily lives. A lot of our patients are used to practicing these measures, and so are often you know, those habits stay with them through a lot of courses of their chemotherapy and also their recovery post transplant. And so I think they're quite well informed about how that works. And so although it's been very challenging for patients and will continue to be so, and I think it's you know, although they can manage and adapt, I think it's difficult to estimate right now what the cost of that anxiety will be later on. I think it's important to have those support infrastructures in place, not just now, but also going forward as we come out of or start to emerge from this initial period.
So based on the different national and international guidelines, for example, some treatments were postponed or delayed. So did you have questions about whether postponing a treatment is going to have deleterious impact on the prognosis, or patient trusted, you know, the decisions?
Yeah, but yes, definitely. But those conversations have very much been held within the context of the physician telephone clinics that have been held with patients, and I personally haven't managed a number of calls around that. So we have patients' medications have been sent out to them via, you know, pharmacy delivery services. So those treatments have continued. The supportive care treatments have continued. So when patients have required transfusions, those have been arranged at the hospital. When patients have needed blood tests, those have also been arranged at the hospital, either at the centre or at their local hospital, sometimes through their GP surgery. So where care has been required in terms of supportive management, then that has been delivered. And I personally haven't had a huge number of inquiries or questions around kind of chemotherapy courses or transplant deferrals, because that's just not the end that I'm dealing with.
Yeah, so here I'd like to emphasize, especially if there are patients and families watching or listening to us, that all of these decisions are being taken very carefully, very cautiously, and we do have, there's no certainty, of course, in such an uncertain period, but we do have a lot of evidence suggesting that by delaying this procedure or this cycle of chemo, we're not inducing any negative impact. It's just some extraordinary measures for extraordinary circumstances. And I must say, I was personally very impressed by some patient. Theoretically, we're supposed to support them and help them. And I have received, and many of my colleagues and nurses also received, a lot of messages from patients actually asking us, how are you doing, doc? How are you doing? And please stay safe, keep well, etc. Did you have the same experience?
Absolutely, yes. And I think the public support for key workers, I think that has been kind of a consistent theme globally, really. I think particularly in the UK, we have this sort of weekly clap at 8 o'clock on a Thursday, which has just felt incredible, really. It's I've felt very emotional each time it's happened. It's very touching. Yes, lots of messages from patients, making sure that we're looking after ourselves and that we're keeping safe. And again, the fact that those thoughts extend to from our patients to us is very touching indeed, and really means a lot. It's really really nice. And I think that again, I speak for the organisation where I work, but I'm pretty sure this is happening everywhere. There've been so many food and refreshment donations for staff working at the hospitals, and that again has been really sort of really nice. Again, it just makes everybody feel appreciated, which is it has been really good at this time. I think in terms of sort of mental health and well-being, I think this is a time where we also need to look after each other as well as our patients, and really making sure that we are supporting each other and taking time for self-care as well. So whether that be the time that you spend with your family, the time that you spend at home is quality time, and being able to reflect as well. I think as health professionals, we often function very much in the moment, particularly at a time where demands that are being made are quite high, and we don't take time to really reflect in the moment, but we may do that afterwards, and so that's really important. We have quite a big mental health strategy that's available, that's been rolled out to support staff well-being during this time, and there are various sort of psychiatry and psychological therapy colleagues who are linking in through various means, whether that be directly with ward areas or teams, or whether that be sort of through a helpline or a number of wellbeing hubs that we have set up. And again, those are working quite well. I think very nice to know that that support is there and it's available, whether staff utilise that support now or whether they utilise that support in the future as we sort of start to emerge from this initial phase.
So you're bringing extremely important messages. I'd like to insist again that we're extremely thankful to all of this generosity around with food, drinks. And by the way, in France, we have daily clapping at 8 p.m. for the healthcare, 7 days a week. So, and I know this tradition is now spreading all over across the globe in many countries in different fashions. I've seen in Spain, but also in the US, that the police cars, for instance, are visiting, in front of the hospital with all the lights. And okay, so that brings me to the third question of our discussion. So we've been talking about what's happening today, and again, your overall feeling is rather positive, although of course we are all affected by this tragedy. But the reaction has been extremely positive, constructive, and collaborative. And when I open any newspaper, when you go, you watch the TV, I always hear now about the day before and the day after. It looks like there is now before and after COVID-19. I don't know when this COVID-19 will stop, but assuming and hopefully it will disappear very soon. So from a nurse perspective, from a professional standpoint, do you foresee any changes, or, what are your thoughts? Because, for instance, just one example, when it comes to medical education, well, exactly like we're doing now, I hear a lot of people saying, well, we'll travel less, we'll have less physical meeting, and we'll have virtual congresses and so on. So how do you feel that the post-COVID period will be from a nursing perspective?
Yeah, I think one of the biggest changes that we've implemented during COVID has been to conduct a lot of our clinic consultations, either through sort of web consultation or telephone consultation. And I think to a certain extent, some of that activity will continue after COVID. But I think we also need to think about, patient preference and the appropriateness of that for certain patient groups. So I think that requires some planning if that's, some of those activities continue longer term. I think that the support that our patients will require after when we start to sort of change some of the things that we're currently doing again, that will require some very clear communication with our patients and their families around how that's being done and what changes will be in place that may be different from the way things were previously. I know a lot of staff have expressed a desire to continue their commitments in working differently and supporting different clinical areas or practicing differently, which again I think is a nice sort of collaboration that has emerged from this. you know, again, I've heard quite a lot of people talk about reducing the number of meetings that they have, departmental meetings that they have, and really trying to frame some of those meetings in a different way, so that people spend a lot less time talking and a little bit more time being able to do some of the doing. I think we also need to think about the impact of social distancing measures. As you say, Mohamad, you know, what will post-COVID be? Will it be post-COVID, or will we just continue with COVID, but in a different sense, a much less critical sense? And me really thinking about social distancing and the impact of that on some of our day treatment or outpatient services, clinics, meetings, and again, as you mentioned, the impact of that on national and international scientific and Congress type meetings. I think there's also potential for a number of research questions that lend themselves to the nurses' viewpoint, questions around patients' experiences of shielding, experiences of telephone consultations, and their experience of having a slightly different context with their hospital providers.
Well, this is really a wonderful summary. I have really enjoyed this discussion, and I do thank you a lot, Michelle, and all your colleagues across the globe for all your efforts, for all the care you're providing, not only from a technical point of view, but with lots of humanity and care. I think we are all grateful. So thank you again for sharing your experience for this webinar by the International Academy for Clinical Hematology. And I hope to see you soon. Thank you.
Thank you very much, Mohamad.